The Knowledgeable Provider podcast is intended primarily to entertain, also to inform, but it is not a substitute for actual medical training and should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, please make an appointment to see your own knowledgeable medical provider. The opinions expressed by me and anyone else who happens to appear on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than the lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. Look, this is all for fun, okay? Don't sue me. All right, on with the show. Hello, welcome back to Knowledgeable Provider. I'm your host, Jody Marks. I'm very excited to bring you the last in the series of my conversations with Dr. Todd Oyen. You've heard him on the podcast before, speaking as an EMS provider and an EMS educator. He was also kind enough to share with me his experience being a patient with Charcot-Marie-Tooth disease. As it happens, September is Charcot-Marie-Tooth Awareness Month. I'm going to act like I planned it this way intentionally, and you can believe that or not. But it's a perfect time to share this with you. I want to thank Dr. Oyen for all of his time and sharing all this personal information with me. Check out the show notes for links to all the resources that Dr. Oyen mentioned during our conversation. And yeah, here you go. Hope you enjoy it. Dr. Todd Oyen, welcome back to Knowledgeable Provider. I'm so happy to be talking to you again.
Well, thanks for having me again. This is great.
I'm very excited to have you back. So last time we chatted about education and EMS and had a pretty wide-ranging conversation, I would say.
Yeah, we talked about quite a bit.
You're here in a totally different role today. You are a patient with Charcot-Marie-Tooth disease.
Yes.
I'm very curious to learn about that from you and about your experience. So I'm just going to shut up and let you talk about it.
Okay. Well, most people, when they hear Charcot-Marie-Tooth, they think something dental, but it was named after three physicians from late 1800s, 1890s. They also came up with ALS, some of that type stuff. So they were neurologists back in the day. Charcot-Marie-Tooth is a genetic condition that affects peripheral nerves. I don't know how the genetic condition knows peripheral nerves versus central nerves, but there's not a lot of evidence to show that like brain and spinal cord get affected, but everything outside of that can be. And when I was first diagnosed, there was not a whole lot of information, but there's been some leaps and bounds in the last 10, 15 years. So we are understanding how it affects the body more. But basically, there's about 160 different types, I think now is what we're up to, based on which gene has been affected. But in essence, one or two things happens. Either the myelin sheath around the peripheral nerves is damaged or the axon is damaged. So regardless, it's one of those two. And then the nerve dies. And typically the longest nerves are the ones that people have the issues with first. So feet and then eventually hands, because those are some of our longer nerves. Although depending on which subtype you have, sometimes shorter nerves get affected. And things like swallowing and breathing and bowel movements and sexual issues and all that can play a role. But for most people, when they think Charcot-Marie-Tooth or CMT, they think the feet and having to use walkers or wheelchairs or braces, and then ultimately not being able to use your hands.
This is an ignorant question. There's a Charcot foot, right? Charcot foot?
Yes.
Is that the same guy?
Same thing, yes.
It's the same thing?
More or less, yes. Many people have the Charcot foot that have Charcot-Marie-Tooth.
Okay, got you. So same neighborhood.
Yes.
Yes, okay.
We end up a lot of times with real high arches and hammer toes and deformed feet and all that because the muscles don't get the nerve impulses like they're supposed to. So typically one group of muscles is working better than the others. And over time that causes the foot to become misshapen. When
I was reading about CMT preparing for this, I would have thought it was an extremely rare thing. But one of the things I read was that it's like the most common inherited disorder of is it myelin disorders?
Would it say nervous?
Okay.
Yes, it is. It is classified as a rare disease. So you're not off with that, but 1 in 2,500 people have it. So that's actually fairly common. I mean, even here where I work, there should be a couple of us. And interestingly, there's like 2 of us in this building that have it. So I think it is probably greater than 1 in 2,500, but people don't always recognize it. Or maybe they had that uncle that just kind of limped a little bit all his life. And now they have some of the same issues, but they never really tested and thought of CMT.
How did your diagnosis come about?
Well, I have CMT2, and we think subtype 2A, according to my genetic profile, which typically strikes in mid to late life. Although, as a kid, I remember having restless legs a lot and sometimes having issues sleeping because of that. Tinnitus, the ringing in the ear, which can be associated. One of the things you think about, everything in the body that has a nerve to it, which is like everything in the body. So it's hard to not say, oh, I have this, it must be because of CMT, or I have that because. So growing up, I don't really remember being terribly clumsy or having issues. I played sports. I was in baseball and soccer and scouting. So I was pretty active as a kid. I felt I was fairly athletic compared to a lot of my friends. We rode bikes everywhere. I didn't have any issues. I ran cross country and track in high school, and I tried baseball one season in high school and didn't like that. I liked running more, which is strange to most people, but I enjoyed track more. So I did that. I wrestled, and then, of course, martial arts. So I started that my freshman year also. So in many respects, I did a lot of my own physical therapy. So things to help treat somebody that has symptoms of CMT involve a lot of stretching and muscle work and activities and staying active and movement. So my martial arts has been an awesome treatment for this. So I guess I started noticing probably early 20s that my feet were a little numb and my shins were a little numb. But I also had started at a time when martial artists were like really, really hardcore. So we would like hit our own selves with sticks to try to kill some of the nerves. And you've probably seen or heard people going out and kicking trees to try to kill the nerves in your legs so you can kick harder and all that stuff. And yeah, the expression on your face is right. That was stupid. That was dumb. Knuckle push-ups to a certain extent are okay, but when you are like 40 years old and can't write your name because the arthritis is so bad, that's dumb. So I just kind of attributed the loss of sensation in my legs to that I was barefoot a lot and kicking a lot and just figured I'd toughened up. I was a good martial artist. And then one day I was out for a run and felt just a real terrible pain in one of my Achilles. And I said, oh, I know what that is. That's really bad. And I limped around on it for a couple of days, being a typical paramedic and thinking, I'll get over this. It'll be all right. And it wasn't. So I went to the doctor and he was doing stuff to me and I was watching him do it. And he's like, does this hurt? And I'm like, nah. He's like, does this hurt? I'm like, no. He's like, well, you're torn your Achilles. I'm like, okay, I kind of figured that. And he's just poking and prodding and moving. He's like, does this hurt? I'm like, no. I said, but I'm a martial artist. I kick people for a living and I've toughened up and I've killed all my nerves. And he's like, yeah, you don't do that the way that should hurt. I'm like, well, it doesn't. And he's like, well, you've got a problem.
Wow.
That physician is not here anymore. He moved to another state. He was really interested in the running side of things, which is why I got sent to him initially.
Is this an orthopedist?
He worked at Bone and Joint.
Okay.
Really, really good guy, really nice guy. And I'm very thankful that he did a thorough assessment on me.
Yes, absolutely. I was just thinking, I bet that was an easy thing to miss.
Well, it was for everybody else, myself included. I didn't attribute this to anything. So he sent me to a neurologist and she did a kind of a local nerve conduction study, which was uncomfortable, but not bad, and did some other reflex testing and then touch hot, touch cold. But interesting, I tend to feel that backwards. So if I put my feet in like a hot tub, it feels cold. My brain says that's cold. And then if I'm like walking on ice or snow, that feels real hot. So she came back with the diagnosis of Charcot-Marie-Tooth. And I'm like, what in the world? Because being in medicine, there's lots of things I've never heard of, but never heard of that one. So I'm like, no, my teeth are up here. It's my feet that were. And she said, no, that's the name of the three doctors. So I just started researching it after that and realized there wasn't a lot. We had a support group locally for a little bit that I was vice president for, but we had such poor turnout that we kind of disbanded that. But that was kind of how I got started, all because of torn Achilles and a doctor doing a good exam.
You mentioned the restless leg when you were a kid and the tinnitus.
Yes.
Is there anything else now looking back that you go, oh, that's what that was?
No, not really. I didn't suffer a lot of injuries or anything as a kid. I don't remember being terribly clumsy. I feel like I'm clumsy now, but as a kid growing up, I don't think I was clumsy. Those are some of the early signs. I never had any scoliosis. We had to do that test every year in grade school where we bent over and the doctor looked down your spine and all that, but nothing there. And when I walked, nobody ever said you had an unusual gait. I didn't have a lot of foot drag or kicking things with my toes. I didn't seem to trip a lot. And then I think by the time it really started developing, it's typically a slow progression. My martial arts training kind of hid that because I was still able to balance and be strong and all that.
I don't want people picturing somebody that like goes to Taekwondo twice a month or something. Like, you want to talk about your level of martial arts involvement?
So I started in Taekwondo, and the Taekwondo school I started in Middleton, Wisconsin, had classes 6 days a week. And my parents wanted me to take these classes because I was extremely shy and introverted and just would not talk in school. And they thought this would help my confidence. And I think it has, because I went in there and I did my first month of free introductory lessons and absolutely loved it. And then I was there 6 days a week. But I was also on the cross country team and the track team. So I was very probably the best shape of my life at that time. I ended up getting my black belt in Taekwondo there after about 3 years, and then ended up moving to Atlanta. And this is one of the things that I really kind of pleased with looking back on life. I taught for a program called Young Olympians. It was some grant-funded program where I was paid $1 a student to go into the inner city neighborhoods of Atlanta and the housing projects and teach martial arts to minority students. So I taught there for the couple of years that I was there. And then when I moved to the Shoals area, I talked to the Taekwondo instructor, and it seemed like he had a great school, but he was all about the competition. And I had reached a point, because I fought full contact in my early days, where I was like, I got to go to work tomorrow. So I can't really afford to have too many things broken like I used to. So it just didn't interest me as much. And then I found Tung Soo through an instructor or a professor at UNA who took it. And he said, you got to come try this. So I did, and I absolutely loved it. So starting in the early 90s, I decided to start over as a white belt and work my way up through the ranks of Tung Soo. I now have a school at the Y here in Florence. It's just Oyen's, North Alabama Tung Soo. But we're part of the World Tung Soo Association, one of the largest martial arts organizations in the world. We got about 25,000 students across the world in like 30-something different countries. But I've stuck with it long enough now that I've gotten old enough that they started giving me belts. They say I earned them through a lot of training and testing and all that, but I really sometimes wonder if it's just because I've gotten old. But I'm a 5th degree master with the World Tung Soo Association. And I still teach 2 nights a week for about 3 or 4 hours a night. And then we do extra things typically on the weekends.
That's been a huge part of your life.
Oh, it has. I did start it before my EMS career, but only by a couple of years. So I should be coming up on a 40th anniversary soon. I think next year. Yeah. Next February, it'll be 40 years of martial arts.
Are there more levels? Are you as high as you can go?
Our association has 10th as the highest level.
Okay.
But 10th represents perfection. So the only way to do that is to die and go to heaven.
Oh, all right.
So 9th is the only practical. And that's the grandmaster of our association, who is William Strong, Dr. Strong, who taught at UNA and is originally from Texas, but he's lived in Killen for like the last 50 years. Kind of cool. We have the leader of this massive international organization right here in town.
Is that who initially got you into it at UNA?
No, actually, it was Mike Hall, who was outdoor education and HPER instructor. And I was taking outdoor ed because I like doing things outside. Thought it would be an easy 3 credits, which it was not, but we had a really good time. So he had me come try it out.
So how has the CMT affected you in the martial arts realm?
It has. I am nowhere near the martial artist I was as far as technical ability. So while I still can kick head height, it's not as easy and definitely not as fluid and as fast as it used to be. I don't move like I used to. At the end of the night when I've taught these classes, I am just physically wiped out. And for somebody with CMT, with the muscle wasting, they estimate that it takes about 3 times the amount of energy to do an activity that somebody without CMT doesn't. So if I were to do an hour of martial arts for a normal non-CMT person, it would be equivalent to doing like 3 hours of martial arts. So definitely has impacted, I think. It's always hard to say that, I'm in my 50s now. I was in my teens when I started. So how much of it is natural aging and just not working as well? So when people ask me about stuff like that, it's like your body is aging faster than it's supposed to.
How about in other areas, just day to day? How's it affected you?
I hike a lot, and that is one of the things that my doctor really cringes whenever I talk about that, because they really want me to walk on like smooth surfaces because the risk of tripping and rolling an ankle or something is so much higher. But again, I've been hiking since Cub Scouts. So I was, 7 years old when I started hiking, and my parents would take us all the time out in the woods. So I keep doing that. But again, I'm not moving like I used to. But again, that may just be normal age. I do know that I don't feel things as well with my hands as I used to. And I am greatly concerned about things like starting IVs and palpating veins, palpating pulses. I worry a little bit about intubation, whether I can manipulate the tube as well as I should to put it through the cords. So I don't want to admit that it probably has affected some of that, but I suspect it is beginning to, if it hasn't already. So I don't know if I will ever really get back on a truck, because I want to provide the best patient care I can. And I don't know if I'm the person that can do that now.
That makes me sad to hear that.
Yeah, me too. But it's life. I turn it over to the next generation of providers, and I'll do my best to educate them. Because I can come in here in a wheelchair if I need to and teach. And in hindsight, I mean, I knew education was something I wanted to try. I didn't realize it was something that I probably would have to do at some point.
One of the questions I was going to ask you is how much did you try to learn about this after you were diagnosed? But I feel like I already know the answer.
A lot.
Did you really dive into it and like?
Oh, yes. I understand nervous system stuff much better now. I understand gene therapy much more than I ever thought I would. I can tell you specifically SPLTC2 gene, which probably doesn't mean much to anybody. But anyways, that was all very interesting. Being a patient for some of the stuff. So it wasn't long after I was diagnosed, and I had a neurologist here. I got looking around through the Charcot-Marie-Tooth website, cmtausa.org. There was a center of excellence at Vandy. Dr. Lee was there. He was great. He ended up taking a position in Detroit, so he's left. We have a Muscular Dystrophy Association center in Birmingham, so that would be the other place that a lot of people with CMT would go to. But since I started with Vandy, I go up there. In some respects, it's a little bit of just a day trip for my wife and I. We go up to Nashville once a year. But I want to keep my foot in the door there in case there's ever a treatment or a study opportunity, because I will gladly let them poke me, prod me, draw some more blood, give me some weird drugs and see what grows or doesn't grow. And so I say associated with that. But the first time I went up there, Dr. Lee put me through everything, like muscle biopsy and nerve biopsies, which I don't recommend for anyone. Something I had to do, but I don't look forward to ever having to do that again. And then the nerve conduction tests, which they did a small one down here, and that was okay. Then I got up there and I thought, oh, nerve conduction, I've had that done. They did a much more thorough and a much different, I don't know what the difference was, but I feel like I was defibrillated like 30 or 40 times.
Wow.
I don't want to say I had PTSD from it, but when I walk by that room, I think I still kind of cringe and twitch and all that. So I'm sure I'll have to have one done again at some point. So a normal nerve conduction is supposed to be about 35 meters per second, and mine was 7. So that's how much slower my nerves work than the average. And that's pretty significant. So some things like the fact that I still get up and I hike and I walk and I kick and all that for martial arts, I don't want to say I shouldn't be able to do that, but I should be having more difficulty than I do. So somehow my body has adapted and is still doing it, but I think it's because I started being active so early. So I encourage anybody that's out there that's thinking about their kids, get them active, get them doing stuff, get them moving, find something they enjoy doing. If I had not been as active in all the things that I do, I would probably be walking with a walker or a wheelchair now.
You want to talk about the emotional impact of getting a diagnosis like this?
Ooh, that one was tough. I'll admit that was, I had some times, and I still have some times, like when I'm washing a dish or something and it just slips out of my hands and it breaks, because I know there's going to be more and more of that. Getting the diagnosis and the name for what was happening was nice. So at least I had a name. Alan Jackson, the singer, he recently said he would kind of stopped his tours because he has CMT and couldn't stand on stage anymore. So, he and I are like buddies now.
Okay.
Never spoken to him, but we have the same condition.
Practically brothers.
Yeah. Yeah. Well, it is genetic, so maybe we are somewhere.
Okay.
So knowing that my body is going to fail me, of course, all of our bodies are going to fail us at some point. Mine's just going to probably fail me sooner than I would have liked. Although they say this is a weird thing. When I first started researching it, they said that there was no impact on life expectancy.
I read that also. Yeah.
Yeah. I'm like, cool. But then there's also studies to show things like, well, if you ever have to go under for surgery, there's a good possibility that you may have to be in a vent for much longer than normal, or you may not ever breathe normally again, or depending on the anesthetic, you could walk in there but never be able to walk again afterwards. And I can't imagine that these things don't impact. This is where the last 10 or 15 years where there's been so much more research, we see that, there are nerves that go to the heart that are peripheral nerves that go to the lungs and the diaphragm and bowel and all the stuff that are peripheral nerves that we never really thought were impacted because they're so short, but probably are. And even things like the vagus nerve, which is one of those cranial nerves, so it's kind of a weird, is it a central nerve or peripheral nerve? We see that that's affected. And of course, that innervates just everything in your body. So I don't know really why we felt like the life expectancy was not decreased. I think it should be. The loss of sensation, touch. So my wife is a physical therapy assistant, and when I can hoodwink her a little bit, I'd get her to stretch me or to massage, or if I'd had a really tough karate class or something, and she'd love to do it, but I don't feel that much anymore. And that hurts to know that at some point she'll probably reach over and want to put her arm around me, and I will not know that even happened.
Wow.
Or that maybe I want to hug her sometimes, but my hands will get so loss of motor control and sensation that I'll end up smacking her upside the head instead of putting my arm around her. That worries me a little bit.
Yeah, got you.
But I don't know how that's going to play out. We'll have to see.
Just from how it has progressed to this point, or just knowing what you do about your particular variant, do you have any sense of what are the odds that it will get to that point?
I think I have pretty good odds that I'll live pretty normally, simply because at 50, whatever I'm 54, 55, something like that now, I'm still moving pretty good. So I think, if I can make it 20 more years, I hit the average life expectancy. So I think I should be able to hit that without totally losing everything. When I was first diagnosed, I just didn't know. So at one point, I was even looking at things like, well, if my feet don't work, can I still drive a car? And what are the hand controls for cars? And all of my hands are being impacted a little bit more. I don't even know if I could do that. So now I got to find somebody that's going to be a good chauffeur for me being diagnosed late.
How old were you when you were diagnosed? I don't remember if we said that.
I was probably 36, 37 when I got the diagnosis. I obviously had symptoms before that. I just didn't realize it. So a little bit later in life, CMT1 tends to strike early. So there are kids that are almost born with it or have like a real early onset of it. They will have a much harder time. And looking back on it now, the kids that I remember from school that had braces or were in a wheelchair, I wonder if any of them had it, but we just didn't know what CMT was back then. The only thing from a kid to an adult that was kind of an interesting story, my pediatrician had made a note in my medical records. And remember, this goes back to the very early 70s, still Vietnam War type stuff, that I was flat-footed. And he had told my mom, he's flat-footed. He's never going to have to be in the military. You don't have to worry about him being drafted. And so we just kind of figured he was like some sort of pacifist, anti-war type person. Because I remember in high school that my arches were big. I'm like, I am not flat-footed. I don't know where he was. So that's why we kind of figured he was just sort of an anti-war person. But no, my feet, we look at the baby footprints that they had taken, and the whole foot is there. And early pictures, I had a pretty flat foot, but I have a pretty high arch now. And I had a Jones fracture, the right foot, the fifth metatarsal snapped. Of all things, walking across the parking lot to go for a walk. When I felt it, a pop, and I heard a pop. And I remember thinking, that's what my patients say when they broke a bone, that they heard a pop. And I bet that's what that sounded like. But I think a bone would hurt more. But I know I have my CMT, to see how it goes. So I did like a 3-mile walk that afternoon on a broken foot. And, after a while, it kind of warmed up and it didn't bother me too much. But over the next 3 weeks, I continued to walk, I continued to train, I continued to go to martial arts and all that. But my foot just stayed swollen. So I finally went into a bone and joint again, and they x-rayed it and said, nope, your foot's broken. So I spent 6 weeks in a boot for that. It didn't heal quite right. So it shifted them. So there's the outside edge of my foot has a big bump where that bone has come out. And if that begins to cause problems, you almost cannot do surgery on that because apparently one of the tendons attaches at that point. So if you cut that tendon, then the foot rolls. So I've been to some specialists about that, and that kind of worries me a little bit. I ended up with a pressure ulcer from shoes because of that. I bought on Black Friday, really expensive shoes that they had half price. And I thought, cool, I'm going to get some good shoes. And within a couple of days, I had a pressure ulcer.
Wow.
And that took me close to 6 months to heal. So that's why they were looking at osteomyelitis and having surgery and all that stuff. And if that did not heal, then I was probably going to lose function of the foot.
Yikes. Scary.
Yeah. So I'm not going to buy that brand of shoe. Nothing against that shoe. It's just that shoe in my foot. Nope.
Yeah, definitely.
I get much bigger shoes now.
I would think you could get custom ones made, yeah?
I could, if I was not stubborn.
Okay. Fair.
My wife was like, go get orthotics. I'm like, yeah, I'll do that someday. Have you gotten them yet? Nope, not yet.
In your role as a caregiver, have you ever taken care of CMT patients?
I have taken care of a lot of patients who say, I just have neuropathy in my feet and my legs, and they just say I do. Neuropathy is a symptom or sign of something. It is rarely the disease. So, of course, the first question I always get asked is, so you're diabetic, or are you a diabetic? Nope, I'm not a diabetic. So why do you have peripheral neuropathy? Charcot-Marie-Tooth. And then I have to explain that to providers and patients. So I always at least put the bug in patients' ears because I'm not supposed to, I can't diagnose just from what they tell me. But when I see that those hammer toes and that high arch and they talk about neuropathy, I said, CMT, Charcot-Marie-Tooth, not the country music television thing, Charcot-Marie-Tooth. Talk to your doctor about it. Nothing we can really do. But if you want to know why your feet look like that, that's a good possibility. That's what it is.
Somebody like me working in primary care, is there anything to do other than just send people to a neurologist?
Neurologist to get the diagnosis, but then it's all physical therapy, basically. Alpha-lipoic acid, which is a supplement, and it's in most kind of nerve pain pills anyways. That's the ingredient. I've actually had some good luck with that. And I've regained some of the sensation in my feet, which is really not supposed to happen. But every once in a while, my wife will be either checking my toes to make sure if I have any sort of a cut or a wound or anything, and I'll feel something, which I used to not. So I'm a proponent of that. There are some other supplements, depending on what type of CMT they have, that can, but really that's probably best handled by the neurologist. For most of the CMTs, we produce a neurotoxin, and then we don't have the gene to produce the enzyme to destroy the neurotoxin. So getting the right diet sometimes or the right supplements can help some patients. And some people have some really good success with it, but it's very individual. So it's hard to kind of say, oh, if you have CMT or you think you have CMT, you should take this. And even though I recommend the alpha-lipoic acid, that one seems to be pretty safe, but there's probably some version of CMT where it may not be.
Good tip. Thank you. When you were saying that, I'm thinking back to all my patients who have neuropathy, and it's like, well, I don't know, you're not diabetic. I just have neuropathy. There are a lot of those out there.
Yes.
Yeah.
And people can cause neuropathy from a lot of, you see it a lot in the military because of all the heavy weight and walking and more walking that they do.
Sure.
And boots, and they can damage their nerves. I mean, you can do it other ways, but a lot of neuropathy is a symptom of something else.
Yeah, and I never know what to say when the patients are like, well, why do you think I have neuropathy? I don't know. Here's your gabapentin. Have a good day. That's going to help me a lot, just being on the lookout for it and being more attuned to that, I think.
The original neurologist here in town that diagnosed me offered me like 50 Percocet was my initial prescription.
Oh.
Of course, this was back before the whole opioid crisis that we have now. Yeah. But I remember getting that prescription and looking at it and thinking, there is no way. Well, no, maybe I could. This could make me a rich man. Because I sure wasn't going to take them. And I thought it was very odd that she went immediately to that.
Looking back now, that seems incredibly odd.
Yeah, I can't imagine today any doctor just run off the bat doing that.
No.
I don't normally take any pain medicines. You mentioned the gabapentin, and I don't even want to take that because I know it can make people drowsy and sleepy and issues driving. And when I was working on the ambulance, I definitely couldn't. So I just wasn't going to start any of that. And more so before than now. And I think the alpha-lipoic acid again has helped. But I used to have some terrible shooting and stabbing and burning pains. Fortunately, I could generally control it with ibuprofen, at least take it down enough where I could make it through a day. So I was going to stick with that as long as I could before I started anything else. Although every once in a while, a pain just hits me and I may say an ugly word under my breath. I try not to scream out loud.
Sure.
Muscle cramping is probably the thing that bothers me the most. Because even sitting here like as long as we have now, I can feel some muscles starting. And sleeping at night, that's one of the hardest things. If I get into a deep sleep and I'm not moving any, my legs will cramp up and I'll wake up with like both hamstrings or hip flexors. Those have been the hardest, just cramping up and trying to then get out of bed and try to stretch them. And it'll take me 30 minutes to have to walk them off. And then the night's shot. So there's a lot of nights where I don't sleep much. And it's not really CMT, but it's CMT related. And I don't have an answer for you to tell your patients if they have that, what to do. I would never take medication not prescribed to me, but if a Flexeril from my wife's bottle had happened to end up in my pill bottle one night, that seemed to help quite a bit with those. But that was a night where the cramps had started before I even went to bed. And I'm trying not to go to the ER, but when you have just cramp after cramp after cramp and after a couple of hours, it's a good workout though. I mean, the next day I was sore, felt like I had done every leg machine at the Y.
That sounds rough. Are you doing anything else for treatment currently?
Really nothing for the CMT. Now, being a paramedic and having lifted a whole lot of heavy patients over the years, I anticipated having back injuries at some point, and I never really did through my career. That was good. But I've noticed for the last couple of years, martial arts, by the end of the night, my right hip was really, 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 it was just hard to finish out the classes. So I finally broke down and went to the doctor, and that's been a bit of a rigmarole. It went from, your back is really, really messed up. You're going to have like 5 of your vertebrae fused.
Yikes.
And you're probably going to be in bed for 6 months, to, we think you have some arthritis in your hip. I'm like, that's kind of what I thought to begin with. But anyways, I'm getting to do physical therapy now for the first time. And even though I'm married to a PTA, she says I would be a bad patient and I don't follow orders, which is not true. If anything, I'm just an overachiever. She'll tell me to do 15 of something, so I'll do 20. But if she had given me a list of exercises to do, I would. But I stretch most nights and things like that. But anyways, I get to go to real physical therapy now. And that's been interesting to see that as a patient. And it's where she works. One of her jobs, she works 3 or 4 part-time jobs, 1 full-time and then 2 or 3 part-time jobs. But it's one of those that she works at part-time. But I've not had her as my therapist. I've had everybody else there. And it's just been interesting to see how physical therapy works from that side of things.
Is this the first time you've really been a patient, as far as just having a chronic illness?
Yes.
How has that influenced you as a provider or as an educator?
Oh, it makes me very mad.
Okay.
I'm supposed to be healthy and young, and in my brain, I'm still like 22, and everything's supposed to work just fine. So when things don't, it's very frustrating to me. I probably get very aggravated with myself. I try not to get aggravated because some of the exercises, working with balance, you would think after 40 years of martial arts, I'd have good balance. One of my legs, I have okay balance. The other one is just terrible. And so he's having me do these balance exercises, and I'm just frustrated, mad at myself. Nothing else. Just I should be able to stand on one leg. Of course, one leg on an upside down dome is a little bit different.
Yeah.
But there was a day that would have been easy. I would have stood there for hours. And it's not that way now. So, I get frustrated that way. I guess it's good for me to learn a little humility and see how the other side is when you don't have the control that you want. I try to tell that to my students that, a lot of times we deal with patients that are angry and frustrated and mad. And almost always it's not at us, although sometimes it is, but it's almost always because they've had a loss of control. Nobody really wanted to have a car wreck on their way to work that morning. That has messed up their day in 101 ways, and they're really mad. And we just happen to be the first people they can vent to. So I'm trying not to vent at my therapist when I get mad at me for not working like I should. So that's been good to learn that and see that side of things. I think anytime we can experience stuff, not that I encourage anybody to go out and be a patient, but I think having been through some of that helps. And with recent VR visits with my family, it's been good to see things on the other side. Be the patient and, okay, so that's how this impacts that, and I need to change my behavior or might change my things I say. So my dad was in the ER, and we were waiting. And suddenly this guy shows up, and I had actually stepped out to get him a glass of water because we couldn't get anybody to get us a glass of water. And as I'm heading back in, he's wheeling out. So where are you going? He's like, oh, he's getting a CAT scan. Of what? I'm like, oh, his chest. Why? I don't know. Get a CAT scan. And of course, the nurse, the doctor had never come in to even say that we were doing this. So then when the nurse walked in, she said, I need to get some blood. I said, can we talk about why first? She said, well, so we can do some blood work. I said, well, he just had a CAT scan done, which was a test that we did not provide any consent for and we were not informed about. And I could see just a moment of like, uh-oh. I don't want to say fear in her eye, but definitely we just screwed this one up. So seeing things from that side and realizing that that's actually a really important thing to describe what you're going to have done or tell your patient what's going to have done. And she probably had a very busy day and just slipped her mind or didn't get in there like she thought. But that was a really kind of scary thing because suddenly we're like, why are we out of the blue having this CAT scan done? So I think it is important for us to really try to empathize with our patients. And I think being on that side of things helps. But again, I don't encourage people to go out and be patients. Don't show up at GR tonight just to say, hey, I want to see what this is like.
I need to do my patient rotation.
Yeah.
I would think any personal experience with a medical issue like that would make you much more empathetic and much more helpful when you're dealing with a patient that ends up, has the same thing.
Oh, yes, definitely.
One thing I've tried to do with the podcast is interview patients because I feel like, the world's foremost expert on a disease doesn't really know what it's like to have it, right?
True.
I love getting that perspective of like, I can read about this in the book, but what's it like?
Well, I've enjoyed listening to your podcast where people have described things because I think I can maybe have a better idea what to ask or what to look for with my patients. And emergency medicine is not your primary focus now. So a lot of the people you had on there are not like, oh, he talked about this. I'm going to look for that in my next wreck victim. But it's all still knowledge that I file away. And one day I'll pick up a patient that has that. And from your podcast, I'll have a better understanding.
Oh, man, that would make my day if that ever happened to you. Jeez. Please call me and tell me if that ever happens.
I will.
I'll feel good about that for a week if it ever happens. Earlier, we were talking about retirement. And
yes.
Has this diagnosis affected plans for the future?
Definitely. One, if I had ever questioned my desire to, not even desire, if I'd ever questioned about not working on the truck full time, this would have sealed it because there'll be a day where I won't be able to pick up patients well and won't be able to do the IVs, stuff like that we talked about. So moving into education has been a good move. But even so, I know there will be a time where my body is not going to be able to do the things I wanted to do. Maybe not from loss of function, although that's going to happen some, but just the fatigue, because that I already sensed. There are days where 8 hours into a day and I'm just like done. And I don't know why some days and some days not, but I anticipate there'll be more of those type of days. So this is one of those things we should all understand much earlier than we do in life, is that life is extremely precious and we should enjoy every moment of it. and we should really retire from like 20 to 30 years old and then work until we die. Because at some point I'm going to retire, and I'm going to retire sooner rather than later because I want to get out and enjoy some things that I can't do when I'm working. But I don't know if I'll be able to enjoy them at that point. So I'll have to take it, kind of year by year. But I definitely have a retirement goal in mind. I have a younger wife, not a terribly younger wife, but I also got to make sure I don't retire too early. I have a lot of things I want to do, and we have a lot of places we want to go and things like that. But I also don't want to retire and then sit around for like 3 or 4 years waiting for her to retire. Sure. So I figure as long as I still love teaching and I can do that, so I'll do that until she's ready to retire, and then we'll go see the world.
Awesome. Don't answer this if you don't want to get into it, but this is a genetic thing. So is there any impact on your kids?
I'm going to say yes. My daughter Emily had a lot of restless legs, which now I suspect but again, if she has the same type I do, then she's probably going to live most of her life with not any major issues. In your 30s, you start noticing it. Proud of her for being a vet, but I wonder at some point that loss of sensation in the hands might impact surgical ability.
Sure.
William doesn't seem to have any signs of it, or it's even more mild of a case. So we'll see. So really, to throw a kink in this, I'm adopted.
Oh, okay.
So I was just a couple months after I was born, my parents adopted me, and the only parents I've ever known, and they have been the best parents a person could ever have asked for, and amazing people and very loving people. And it was never really an issue until I got this. And then I was just curious about it. So I had reached out. There's a channel through, because back then there was not as much, records were sealed, more so than they seem to be today. So I reached out through the proper channels through DHR and all that to see if I could get some. And I got some forms filled out by supposedly my biological mother. And at that point, she said no, there wasn't anything. And then we were going to have a phone conference about it. And that ended up going very poorly. Might be a nice way to describe it. I understand she probably did not want to ever hear from me. Well, no, she's made that very clear that she did not want to ever hear from me. And I respect that decision. Plus, I don't know what she's like, but she can't be as good as my parents. So I don't know if there's really anything in that side of the family. The initial paperwork that she filled out said no. So I seem to be a new mutation.
It's dominant inheritance, right? Autosomal dominant?
Mine is, yes.
Okay.
I don't know if they all are. Probably. There's so many variants in it now. When I first got diagnosed, there was like 15 or 20. But I guess as more people have had genetic testing done, we realized that, and we really break it down into 1 and 2, but then there's a CMT4 and a CMTX. The X has to do with the X chromosome issue, and then I forget what 4 is. So, there's 2 basic, again, the myelin or the axon, and then a couple of subsets of that, and then a whole host of minor subsets.
Going back to like what it's like to actually have the disease, anything you found that someone would not get from reading about it in a book? Like if someone has been diagnosed, is there anything that people should look out for that maybe you wouldn't think, or maybe their doctors wouldn't think to tell them about?
It may affect more of the internal organs than we realize. So that's something, heart disease and lung issues and bowel issues are all fairly common. Swallowing and chewing can sometimes be an issue. So make sure everybody around you knows how to do abdominal thrusts.
Sure.
When I first, and I don't know if it's my personality or just the articles I started reading at first, it sounded very like, oh, you're doomed. And that's not the case. For most people, I think they live pretty healthy, happy lives overall. I mean, obviously with the issues, but you can still live at least a happy life. So don't get too down on it. We are making a lot of progress. There's a lot of research that's happening. I think there'll be some medications to treat it in addition to the physical therapy and the stretching and the exercising that we're supposed to do.
Do you know of anything specific that's on the horizon?
CMT1A has a stage 3 trial drug. And that's the one that, whatever stage it was, when they did it on the mice, they basically reversed it. And they ended up with normal activity afterwards.
Wow. Super exciting.
Yeah, it is, if it translates to humans. And so far, the preliminary stuff I've read, it is very positive.
Any other resources that have been helpful to you?
There's a Hereditary Neuropathy Foundation, HNF, and that's a database. And I go back and forth on that. I go to it a lot and I look at it a lot, and I have my information in there in case there's ever a study done on CMT2 that I might fit or be able to be a patient for. But you go through the discussion posts and things, and I think a lot of it is some of the worst case scenarios, because you read through this stuff and it sounds incredibly depressing. So there are some very severe cases of this. And I think those are the people that tend to post the most because they're looking for ideas and help and all that. And they've kind of run out of anything with their regular channels because it's all about, well, exercise, stretch, physical therapy. And they've heard that for years and years and years. So they're looking for something. And there's just not a lot out there. So you read that stuff and it sounds, oh, I have this and I can't do this and I can't do this and this person, I can't get my disability. I can't. So you can get very down if you read that too much. So don't get down on it, even though HNF is it's a good resource. And then Muscular Dystrophy Association, they have some resources too, some information. But again, until we get some cures out there, there's really, I mean, you can read about it all you want, but still going to tell you to go out and exercise some, go for walks a lot, stretch some, and do yoga or Pilates or Tai Chi or whatever for your balance. Occasionally, a CMT support group will pop up. Like I said, I was a vice president of one here in the Shoals, but we had poor attendance, so we ended up folding it. There was one that was going to pop up in Southern Tennessee. I went to a couple of their meetings. Actually, a nurse that I used to work with had it, and she didn't know, and she got diagnosed, but then some weird things happened there, and that group kind of folded. And then I think there's one in Huntsville that's trying to get active right now.
Okay.
But I don't know a whole lot. I have not heard much from them, maybe since pre-COVID now. So that may have folded them. But they were getting pretty active. I never actually made a physical meeting with them, but I did a couple of Zooms, and they seem to have a little more. Of course, Huntsville being a bigger city, they had more people. So you can look for support groups, and there are other support groups. Usually there is some sort of activity in September, which is CMT Awareness Month. So there's a lot of CMT walks and bikes, though it's funny because a lot of people with CMT probably shouldn't be riding bikes. Going for walks is okay, but you got poor balance and you don't feel your feet and you can't work your hands real well. Bicycles are just not a good thing.
Fair.
But they do it for fundraisers. But most of that stuff can be found through the CMTA, Charcot-Marie-Tooth Association. I did a couple of fundraisers when I first was diagnosed. We had walks, but haven't done anything in a while. But there are some supports out there. I don't know if I really have time right now. I don't want to say I don't have the desire, but the effort it would take to run an organization or a group like that, even though it's just a support group type deal, I don't know if I have that, but if somebody is willing to step up, I'll gladly provide some support.
Okay. Well, Dr. Todd Oyen, thank you again for coming on Knowledgeable Provider. It's been such a pleasure. I really appreciate all your time.
Well, thank you for taking the time to do this and let me talk a little bit about CMT and getting the word out there. So maybe people will know about it and I won't have to talk about my teeth so much. All right, that does it for this episode of Knowledgeable Provider. I'm your host, Jody Marks. Thank you so much for listening. Please be sure to like, subscribe, or follow on your preferred listening platform. Give us a nice 5-star rating and leave a nice review. If you'd like to help support the show, you can do that at patreon.com/knowledgeableprovider. And as always, stay safe, take care of yourself, and take care of your patients in that order.